So when you're hyperthyroid, your temperature can be high, your heart rate can be high, versus hypothyroid, where everything is slowed down like a torch. And this is what we've been through already. The agitation, the tachycardia, new onset atrial fibrillation, new onset psychosis, new onset anxiety. People should be worked up, or do they have a thyroid problem? I can't talk about how other people do, but you, as a practitioner, you look at people up. Need to be figured out. Thyroid storm. When you look at this stuff, high fever, vomiting, diarrhea, tachycardia, heart failure, cardiac shock, restlessness, agitation, abdominal pain. Doesn't that sound like someone's septic? Could be urosepsis, could be pneumonia, could be a whole range of things. And if the practitioner doesn't get the history that they're on thyroid medicine, they might have taken too much medicine, they don't get better because you end up having to take pills. But anyway, just think about it. Management, beta blockers, steroids, fluids. Myxedema coma, I'm so slow, I'm a turtle, I don't have any eyebrows, I'm puffy, I'm big, and myxedema coma, really, everything is slow, decreasing. The thyroid that gives the juice to make go is not. Infections, cold environment, they can look like they're been in Minnesota in the winter outside with the winter jacket on. Coldness, and your brain is slow. So here's the signs and symptoms. And again, it's hard to separate things out. That's why history is real important. How did it start? How is their daily life affected? Are they slow? They got slow in terms of their speech. How they had weight gain. But it's profound. Yeah.
Is there a treatment for that myxedema coma?
Yeah, you give them some thyroid medication. Yeah, and then they're on thyroid medication for the rest of the day. And it's a very gradual process. A friend of mine's boyfriend, he ended up with myxedema coma, and it was like over 5 years. It was like I met him once, and I met him 3 years later. I'm like, boy, he looked really different. He lost all his hair, eyebrows. He was slow thinking. His voice changed. He was a musician, and he couldn't perform anymore because he had a beautiful voice, and his voice is changing. He got a worse voice. Once he got on the thyroid medication, his voice came back, which is lovely. And he was actually a performer. And it's just a slow, gradual process. And this is what you get, this doughy, thick skin. And again, everything's ABCs. The last one we haven't talked about is the adrenal glands. We have 2 of them, right? 2 parts of the adrenal glands. And you don't really need to know that there's 2 parts of the adrenal glands. You don't know that you need to know that there's a medulla and the medullary and the cortex, right? Do they need to know all that stuff? Possibly. Okay. Because basically the adrenal glands, they make cortisol and they make adrenaline. 2 things they need to have. And there's ways that people can have. So the way to think of it is this. So Addison's, 2 A's means you don't have enough. Addison's is adrenal insufficiency. So they don't have glucocorticoids. They don't have mineral corticoids, which means that your fluids off, your electrolytes are off, okay? And your hormones are off. And people present as they're on steroids. There's treatment of steroids. If you don't have it, so you're given steroids to live, immunoglobulins. So if they don't take them, what happens to them? They go into shock. Their electrolytes are out of whack. And then the other form is you have too much, which is called Cushing's. Oops.
Oh.
So too much. So when people are given medications to take, sometimes they take too much inadvertently. It's not they don't take it properly. Their weight changes, their metabolism changes over, and they get basically Cushing's, where they have a moon face, and it's pretty pronounced. They have a hump in the back. You see people with hump. They have the skin is very thin. And increased hair. And you see, this is what moon faces look like. They're very rounded. And sometimes you'll see people who've been on long-term steroids, long-term prednisone, and they'll start to have moon faces. They'll start to have bigger cheeks, and you'll notice that when you see people, because it's affected their metabolism. It affects how deposition of fat is seen. And so both sides of the coin can cause people to have problems with their electrolytes, problems with their blood pressure, and problems maintaining the homeostasis so they don't get infections. Okay, now for the fun part. Maybe. What am I looking at?
My house?
Okay, so you have raccoons and you have all these 45-year-old male who basically his brother's sick, jumps in the car, drives away. You see the house is filled with various trapped animals. And then you get to see odd-looking substance cooking in the pan. You say, oh, dinner. And it's parts, which the person is throwing out.
Rabies.
So besides being roasted, what's your differential on this person?
First time's rabies.
No, he would be more hydrophobic than that. Honestly, they probably have severe food poisoning, or they eat something that has parasites, or they picked up a vector-borne disease from the animals.
Okay. What do you EKG on this person?
Mm-hmm.
How many people say yes? 1, 2. Okay, so that one person was there, and they did an EKG. He's pale, diaphoretic. He really doesn't want to talk much to it. And they do an EKG, and this is what you see. Does that look like a rabbit EKG? Does that look like a normal EKG? No. Is there anything normal in this EKG?
Yes.
What?
So,
The heart rate's not too fast, right? But you have like tombstone things in the anterior lateral area. You have Q waves, so it's been going on for a while. Q waves are over here, and it's going on. You have some reciprocal changes, so the person's having a heart attack. So just because the person has raccoons in their house and cooks them for whatever, doesn't mean that don't get distracted by the shiny. Right? Because the person's having a heart attack. Do you have any questions at all on endocrine stuff?
So that patient was a diabetic. I did this call years ago. And diabetics who vomit constantly with no chest pain, you definitely want to make sure you do an EKG because that's what was going on. This patient,
Where
so.
is this?
It was in Wappingers. But yeah, so anytime you have a diabetic who's vomiting, definitely consider cardiac. because of that neuropathy that she talked about, they don't have the same chest pressure, chest pain that a normal person might have or complain about. But the vomiting is because of the irritation, so they're vomiting.
Any questions at all? Comments, criticisms, witticisms? Anything? So you know the difference when one has insulin and one doesn't have insulin, why you get what you get, right? And words are descriptive. Okay, that's it, we're gonna need
We're gonna have lab.
lab.
We'll give them a few minutes while we get stuff squared away.